My patient XYZ, 25 years of age. She is married for the last 8 years with no kids. She is educated till 5th grade, resident of Miyawali. She is a housewife by profession, admitted via OPD 17 days back with the presenting complaint of unable to stand from sitting position and hand contractures for the last 2 years. My patient was in her usual state of health 3 years back when she initially noticed skin tightening of the fingers of both hands that slowly progressed, and it involved both the upper limbs, lower limbs, face and chest, with just sparing of the abdominal area within a span of 1 year. Now this patient presented with the worsening of the same symptoms, that she is unable to stand from sitting position, although she does not have, due to the skin tightening, she does not have any muscle pain, and due to the hand contractures, and which is causing her unable to do her daily activities. She does not have any preceding edema history. On further inquiry, she told that there is a history of bluish discoloration of fingers of both nails. The color is initially pale and it turns blue, which relieves by rewarming her fingers or covering her fingers in the blanket. There is a history of joint pain and bilaterally at the wrist joint, but there is no morning stiffness, or there is no morning stiffness or swelling of the joints. There is also a history of dyspigmentation of whole skin for the last 1 year. Patient is also giving history of fever that was low grade. It was associated with shivering. She never documented it, and it relieves by taking medication, but during this admission she does not have any complaint of fever. There is a history of diffuse hair loss of the scalp, but there is no mucosa involvement in, except she says that there is bluish discoloration of the tip of the tongue while bathing, and no nail changes are noted. She does not have any ocular or oral dryness. There is no history of photosensitivity, and she says that she's having intolerance to cold, but no weight gain or no constipation. There is no associated. There is no history of lumps. History of weight loss is significant, but it was not documented, and she says that she noticed it because her previous clothes are loosened now. Her systemic inquiry is unremarkable, except that she is having diarrhea after taking some medication, but it is now relieved. And she never took any steroids. She took methotrexate for 1 month, but she then discontinued it because of the shortage of money. This disease has severely affected her daily life activities, and because she is unable to do her activities by herself. Past personal and family history is not significant, and socioeconomic condition is poor, as her husband is laborer by profession. On examination, my patient is a young lady of thin physique and well-oriented time, place and person, with granula on left arm, with vitals of blood pressure of 110 by 70 and pulse of 68 per minute, respiratory rate of 14 per minute. She is afebrile at the moment, with pale conjunctiva. She does not have any jaundice, clubbing, koilonychia, and there is no lymphadenopathy noted, and thyroid examination is normal. On cutaneous examination of the face, patient is having generalized full face skin tightening, and which is also involving both the ears, and it is more marked at the chin and the neck and front of the chest. This skin tightening is causing her unable to retract her lower eyelids. There is beaking of the nose, perioral furrowing is there, along with perioral hypopigmentation. She is unable to protrude her tongue or open her mouth easily. Similar kind of skin tightening is also noted on both upper and lower limbs. On the upper limb, it is extending from the fingers till the mid of the arms, and on the lower limbs, it is extending from the toes till the pelvic area, and it is more marked in the inguinal region, and the MRSS score is more than 14. There is also salt and pepper dyspigmentation can be noted, and it is more marked on the dorsum of hands and the extensor surfaces of both arms, on the front of chest, and the extensor surfaces of legs, and on the lower right and left quadrant of abdomen. And patient is also having diffuse hair loss. from the scalp, and the remaining on the background of pigmentary changes of the scalp. However, the remaining hairs are sparse, they are soft in texture, light brown, and easily breakable. On nail examination, the nails are broad sideways, but I could not appreciate any telangiectasias, any erythema, or periangual swelling. The finger pads are bulbous, and on musculoskeletal examination, patient is having flexural deformity at the proximal interphalangeal joint and the metacarpophalangeal joint and wrist joint, which is causing her unable to move her hands. All the other musculoskeletal examination is normal. On chest examination, she is having the chest is moving equally on both sides. Percussion note is resonant, and on auscultation there are fine crackles involving the bases of both lungs. And the heart is the apex beat is in the fifth intercostal space medial to mid clavicular line. There is no visceromegaly noted, and the motor and sensory system is intact. Thank you.